First off, I want to thank everybody for being here and listening to my story. I'm just going to give you a little background. When I was 2, my parents gave me up to my paternal grandparents, and they raised me. They gave up custody. My mother was a heroin and meth addict. She was in and out of my life, mostly out. I remember I would spend days waiting at the window for her to show up, and she never would. And she would only come around for money, and she would say, "Hi, here's this," and that was it. I didn't know back then that she was an addict. I had no idea. My grandparents hid it very well. My dad wasn't involved in my life at all. Really, I don't talk to either one of my parents to this day. Growing up, my grandmother, who was like my mother, had rheumatoid arthritis. So by the time I was 9 or 10, she had progressed so far that she had to take oxycontin 80s 3 times a day. Well, I just knew the pain of not having my parents around, and I had some trauma when I was a child that I didn't remember. I blocked it. So I just remembered pain, and I remember seeing her take her oxycontins, her pills, and being fine after. So when I was 12, I decided, hey, it makes her feel better. It'll make me feel better. So I started taking her oxycontin 80s. By the time I was 14, I was up to 5 pills a day of oxy 80s. That's a lot. I was never educated about prescription pills being drugs and abused. I was just told, don't do drugs. They're bad for you. And basically, it was the people in the slums and the poor people who did drugs. Because my grandparents were older. They grew up in the 50s. So that's basically what they thought. And they thought I would be fine and just listen to them. Well, I didn't want to get caught at the age of 14 taking my grandmother's pills anymore. So I tried heroin because it was really cheap and readily available. I tried to quit when I was 18, unsuccessfully. So I started drinking and using crystal meth. Throughout this whole process, I feel like my grandparents knew there was something going on, but they didn't want to believe it was drugs. I did get caught when I was 18 with crystal meth. My grandfather dumped it down the toilet and said, don't do it again. I immediately went out and got more. And they still turned a blind eye. They didn't want to see their little granddaughter, on drugs and going down that path, the same path my mother took. When I was 19, my grandmother died from rheumatoid arthritis. Her immune system was just so shot. She got lung infections and succumbed to the disease. She left behind 2 full bottles of her oxycontin 80s, which I quickly took. In 2 weeks, they were all gone. I don't know how I survived through that episode. I was drinking, I was smoking weed, I was doing crystal meth, and I was taking oxys. I don't know how I survived. So when I was 19, I moved here for my boyfriend, who is now my ex. I recently had to remove him from my life because he relapsed and was using in my house. A couple years ago, we were using heroin and bath salts. This was, I think, the downfall of me. This was my rock bottom. I was working in a group home. I was so addicted that I would have to go into the bathroom and inject either bath salts or heroin at work. And it was every 10 to 15 minutes I had to use, or else I couldn't function. Meanwhile, I'm trying to take care of my little 6-year-old at home. I don't know how we managed to go I think it was 8 months using like this with nobody saying anything. But finally, someone stepped forward and called DCYF. DCYF removed our son from our home. That was my rock bottom. I went to try to find help, and I was turned away a few times because I was too far gone. So finally, I decided that I would check myself into rehab. It took me 4 weeks to get a bed. 4 weeks that I still used. 4 weeks that my son was in someone else's care when I could have been getting clean and working on getting him back. It was a very discouraging process. I almost just gave up and said, I'm done. There were a few times where I had the syringe full, ready to just kill myself and end it. Luckily, that didn't happen, and I ended up going to the STAR facility. My boyfriend was still using when I got out, so I stayed sober for a good 2 weeks, and then I started using again. I went to the Newport Hospital partial hospitalization program, and they really, really helped me get back on track. After I was done with the PHP, I went to Kodak, and I really attribute Kodak with saving my life. They were there for me every step of the way. My drug counselor was amazing. I got into a mental health treatment there also. I was diagnosed with severe clinical depression, anxiety, and post-traumatic stress disorder. So I got on the proper medications. I got adjusted on my dose of methadone, and ever since May 22nd, 2 years ago, I've been clean and sober. And I still go to Kodak. I go to groups. I go to counseling every week. I see my mental health counselor, and I know if something traumatic happens in my life, which it has in the past few months, that I can go there and I know somebody is there to help me through it. I never have to be alone again. And even when I'm off the methadone, I still know that if I go in there, they're gonna be there for me. They're not gonna turn me away. So I really accredit Kodak. It really works. I just want to talk a little bit about prevention and recovery as a teenager. I honestly think that we need to educate parents, because I think parents, they see the changes in their child when they use drugs, but I think they're so blinded to it because they don't ever think it'll happen to them. It's never going to happen to my family. It does. It can happen to any one of us. It can happen to my son. I hope it doesn't, but it could. And I wish that people had the strength to say, listen, you're going to rehab, or what's going on, to see the problem instead of turning a blind eye, because that's way easier. A little bit of prevention for parents would be great too, and children. I think it's huge for teenage years. The teenage years are hard enough with puberty and clickiness and bullying. You know, we need to get the help out there. Thank you guys for listening.